Yeah. And back to your question about how we can treat it, it is not a very simple treatment because it does involve the bone and underlying structures and things like that. But there are quite a few ways we can treat it. And depending on how how long the patient wants treatment to be for and things like that, we can work something out with Invisalign alone, orthodontics, or together with some sort of auxiliary appliances that we can use together with Invisalign to help push the teeth a certain way. Or we could also do some kind of Invisalign together with some kind of restorative treatment. So we push it up, and maybe if the patient is time conscious, they don't want to spend too much time on it, then we could also sort of augment it with some kind of veneers or bonding, that kind of stuff. And often what I see, and I don't know if you have seen that as well, is when the smile is slanted, the bite or how the bottom teeth touch the top teeth can also be affected. And
because everything is just slanted, right?
Yes.
So one side will be higher and the other side will be lower. But the upper teeth will be is just in opposite.
So that it has to match
Yeah.
like that, right?
Yeah, you're right.
So, and then what happens often is that it also wears down unevenly. So then one side could be even, that slantedness could be even more accentuated because it's wearing down on the longer side and things like that. So then that's when after orthodontics, sometimes the teeth still look a little bit off because it's worn out. Sometimes it's one long and one short. And then that's when we have to think
Then
about...
it's going to be problematic when you align them together, right? Because once you move everything there, one side will be like flat, or one side will be taller than the other one.
Yes.
Then I guess I'll be the one going in to add more volume to that worn down area.
Yes.
To build
Because
it back up.
if it's long and short, then we want to lengthen that short one to make it match in a symmetrical way, right? Then so that's when it's not just something that Invisalign can treat. It has to be
Like a
some kind of...
multidisciplinary approach kind of thing.
Yes.